Welcome to Aradana, Arogyame Mahabhagyam. Today with us we have Director of Christian Medical College and Hospital, Vellore, to discuss various issues related to medicine as well as the perception of college and everything with respect to present day society. Welcome, sir.
Good morning, Ashish.
We need to know a lot of things because of media hype which we have it, and we need to discuss where do we stand as a Christian individuals. Before we go into the various discussions related to this, I would want to ask sir, what is the background which CMC comes from? I remember in 1993 when I joined the college, for me it was absolutely a foreign land. And over the years I have seen that Christian Medical College is one of the leading hospitals in not only in India but around the globe. So let's go back to the history, the origin of Christian Medical College and Hospital, Vellore. Sir.
Thank you, Ashish. I think that's a good preamble to what we are about to discuss. As is known worldwide, the Christian Medical College is now about 116 years old, and it was never meant to be such a big organization. This was actually started by a third generation missionary girl who never wanted to do medicine. In fact, she rebelled against her missionary parents who were in Ranipet at that time and ran away to the United States for a better life. But she, by a stroke of fate or whatever, she came back to look after her mother. And at that time she had a dramatic experience of three men knocking on her doors, asking her to attend to their wives who were in difficult labor. She was not able to go because she was not a doctor or a medical person.
Okay.
And the men refused to have her father, who was a doctor, attend on her. And the story is that all these three women died, and she saw the funeral of these three women.
So all these women died because of non-availability of lady doctor?
Lady doctors. So this kind of hit her very badly, and it converted her from a rebel to a very fired person who then went back to the United States, to New York, to Cornell University. She did medicine and she returned to set up just a one-bed clinic. She just responded to a need of women and children who needed health care, and there was no health care available. And then she was joined by several other missionaries, both from the United States and other parts of the world, and even India, and it grew. First she started to train nurses, then she started a missionary medical college for women, and then in 1947 she made it co-educational.
Oh, so initially it was just meant to be for women?
Just for women. So from that time onwards, the institution has grown, and the college has always stood for training, service and research, which is enshrined in the vision statement. And essentially it is done as a faith-based organization. It's a Christian medical college, and the belief systems and values are rooted in the Christian faith, deriving inspiration from the Lord Jesus Christ, who is the foundation block of the Christian Medical College, Vellore.
Okay. But in present day world, with so much of driving force which comes from materialistic origin, how do you survive? Because if I go and if I check the details, the technology requires money, and if you want to do a mission work, how do you generate that economy, and how does CMC sustain itself?
A good question. You know, CMC is essentially a large missionary organization, but it is self-sufficient. 98.4% of the revenue is generated from patients. Now, how do we do that? Essentially, we believe in this philosophy of what's called both and philosophy, where any patient, rich or poor, is welcome. We have top-notch services state-of-the-art services, equipment which caters to anyone. We have about 30 to 35% of our services which caters to the private clientele who are either self-paying or they are insured or they come from companies. And the margins that the institution makes is used to subsidize, cross-subsidize the people who cannot afford.
Okay.
So that's how. So doctors don't get huge salaries. It's very modest.
Okay.
But that margin that we make from private health is used to cross-subsidize the patients who either have no money at all or have got limited money. So we have a range of poor patients. Those who cannot afford anything and it's completely free. Those who can afford 20%, 80% is free. And those who can afford 80%, 20% is free. So within that we give a substantial amount of charity and care, which is our strength. That's our lifeline. That's the soul of our institution, that we are committed to looking after the poor, the downtrodden, the distanced, the displaced.
Regarding this, the revenue generation, quite a lot of people wonder because of Aunt Ida's background, a lot of foreign investment or the money flowing is there. So do we have those kind of funds? I would want our viewers to know that.
No, actually in the old days, when our founder Dr. Ida Scudder started the institution, there was no money. So it was all funded at that stage by donations from missionaries and all that. The needs were very limited, the expenses were not much. But since 1947 or thereabouts, it's a completely Indian organization. It is supported by a council of churches, and we don't receive any aid in cash. We do have some people giving us small time. It's called the person-to-person scheme, where an individual donates to a poor patient. So it's person to person. It's not to the organization, but it's called the PTP scheme, and that takes care of a lot of people who need medical care and they just can't afford treatment. We also have through the USAID some equipment that comes as donation, but other than that there is no funding at all.
So kind of living up the ideology of Jehovah Jireh, my provider.
My provider, exactly.
So just trying to live that.
And actually it's God's grace that it runs. Sometimes we ourselves are baffled. We have close to 8,000 patients a day.
8,000 patients
coming into the hospital, and old and new together. We have 9,000 staff. We have almost 160 to 180 major operations a day.
160 operations per day.
And about 50 to 60 deliveries in the main hospital labor room. So you can imagine that between this, what a lot of output it, and most of them belong to the underprivileged section of society.
Now, as a doctor, I would want to bring it out. We live in a world of commercialization, and I'm very sure the way doctors get help, and especially people think that they have some cuts for admitting patients. And so do we have any kind of such mode where we give anything to our consultants and the doctors working there?
No, we don't have. And actually we are very proud of staff whose commitment levels are very high. Salaries are modest, and there is absolutely no overtime, no cuts. You can be an anatomist or a cardiac surgeon, the salaries are the same. Happily, and the staff are quite happy to accept that formula. You know, there is something very unique about CMC. I believe that it's run not by humans, but there is a divine presence, and there is God's power as the fuel that runs it, because several things are not explained. How we are able to run this large organization on a missionary principle, attract a lot of people who come, get treatment and go off, and keep on expanding. You know, we have teaching, we have service, we have research, we have outreach, and most of these need a lot of subsidy.
Yes, yes.
I'm sure you know that the fees for a medical student is only
Yes.
3,000 rupees a year.
Absolutely, yeah.
That's unique in the country.
Very much.
Tuition fees.
Yeah.
They have other expenses, of course, but the tuition fees we charge only 3,000 rupees a year. The cost is much more. It's almost 8 lakhs.
Yeah, yeah.
And some poor patient or somebody else is subsidizing that. And I believe it helps to instill a value in that student. When I know that most of my training is being subsidized by that man
Yes.
on that bed, that patient that I see, not directly but in a way.
Indirectly, yeah, in any way, yeah.
Then when I finish, I'm driven by an ethic which says that, look, I have to return this to society. And so therefore my focus of work shifts, that service becomes your driving force, not money, not business.
Yes.
And that is what we believe is taught in the Bible. you know,
Yeah,
so
yeah. We bring Bible, and in between also we read that there are some conflicts do happen.
yeah.
How did you survive through the conflicts? Because I remember there was some major shutdown in 70s
Yeah.
where whole CMC was kind of
Yeah,
cordoned off
yeah.
for 2 to 3 months.
Yeah, yeah.
And if
Yeah.
I'm not wrong, I'm told that the lecturer and the reader were doing the job of a class 4 employee or whatever we
Yeah,
call
yeah,
of carrying the samples of the patient was done
that's
by
true. That's true.
lecturers and readers. So what was that, sir?
This also happened in the 70s, so I don't know a great detail on it.
Yeah,
But it was something that involved the labor,
yeah,
and the hospital had to be shut down.
yeah,
But in that period when the hospital was not being supported by the support staff,
yes,
the students
yes,
and the staff moved over
uh-huh,
into the support areas. For
Yes.
example, students manned the telephone exchange,
oh, okay,
and they even helped with cleaning the toilets, and staff did nursing, and they
Yes.
pushed the trolleys.
yes,
It sounds very heroic, but you know, it was all done with the spirit of let's keep the institution alive, because there are so many patients who are.
So what kind of future plans do CMC look forwards? Because in the competitive world and with the NEET coming in, and I'm very sure the students who are aspiring to become a doctors
yeah.
know that that is a big kind of
Kind of.
block. So do you see that as a block, or do you see that as a hand of God working through that? And
Yeah, CMC is always adapted to changes,
Yes.
and we are still adapting.
Mhm.
And if you ask me, healthcare is at a crossroad in India.
Yes,
Because of the higher economic status and computerization, commercialization, healthcare is also moving in a certain direction.
Mhm.
We are conscious of that, and patient expectations have changed.
yes,
But so what we are trying to do is to make those adaptations to the changes in society without losing focus of the center. That's our vision and mission.
Mhm.
That's very important, because the why of our existence is more important than the how of our existence.
Okay.
So we always revisit our vision and mission. What is it that we are existing for? Why is it Aunt Ida came and established this organization? We don't forget that, yet we do respond to the changes that are happening in society. So we are now stepping into Chittoor,
Okay.
which is a small secondary level hospital now, but that's the way we begin. A small setup of 130 bed hospital and full outpatients. We are now slowly expanding and enhancing the services, and hopefully it will be a full campus one day.
Mhm.
We also have another hospital which we are building. It's actually an expansion to the main hospital in a small village which is about 10 kilometers from CMC in Vellore. It's called Kanikapuram, where we'll be building a new hospital, essentially to decompress this huge amount of outpatients.
Yes.
They're very choked in the environment.
Yes.
So that's our future plan. And of course, we are tying up with lots of mission hospitals
Yes.
to help them build or rebuild. Some of them are not doing too well.
Yeah.
We're doing that. We are expanding our outreach. And we also want to go deeper into primary care. In India we have what is called the dual burden. We have infections and infectious diseases which are not yet disappeared.
Yes.
But on the other hand, we have modern lifestyle diseases. For example, if you look at road traffic accidents,
Yeah.
it's become a major killer in the non-infectious
Yes.
disease
NCDs,
category.
whatever.
Now, it's a public health issue. So, in this new campus in Vellore, we are going to build a world-class trauma center with prevention, retrieval, 3-level trauma care, which will look after patients in the first golden hour when it's life-saving interventions. And then if they survive that, there'll be a limb restoration phase, and then finally a rehabilitation phase.
Okay.
So that's our dream, and we are trying to get manpower, training, resource, and that's what we want, because it's a public health issue. Similarly, as you know, cardiac, psychiatric disorders, strokes. So these are all the new diseases of modern India.
Yes.
And that's what we are adapting to as we build and expand. So that's really the dream for the next couple of years, to keep ourselves relevant to the changing needs of society.
So from this Vellore doctors working in the mission hospitals, what is Vellore's vision for the metropolitan cities and the tier 2 cities? So
A very difficult question. Now, the tier 2 metro cities are full of hospitals.
Yes.
And I guess they also cater to the urban folks who have money in their plastic cards, and they can afford that. So, but personally, I believe that mission hospitals must step into cities as well.
Yes.
You just take Hyderabad. There is a niche for a good, modern, state-of-the-art tertiary care mission hospital right in the center of the city.
Yes.
Because there are people who are poor in the urban areas as well. There are slum dwellers, there are people who cannot afford.
Yeah.
And we must keep that service open even within a metro, even in a 2-tier city.
Yeah.
So it is a dream. We can dream together, and maybe we should dream with the church.
Yes.
Maybe we should talk to people who are overseas, Christians who are overseas, or philanthropists who are overseas, who can understand this need and say, it's not just rural India, but urban India also needs mission hospital care.
Yes. It's such kind of attitude doctors to carry.
Absolutely.
Where they will be able to see that, okay, whether corporate hospital or whatever background hospital comes from, I'm meeting a doctor who satisfy my inner desires as well. So where does a CMC stand along with the other Christian bound organizations? I believe there is a CMC Vellore in the south, and then CMC Ludhiana in north, and St. John's. So how are we connected?
Well, we are connected through partnership. The Christian Medical Association of India and the Catholic Health Association of India are partners in healthcare, and I have attended many meetings where they are beginning to now converge onto a common platform to see how we can cater to the larger mass of people. I understand that we have about 80,000 beds within the Christian network.
Oh, that's a big
which
number.
is just next to the government.
Okay.
So that's a significant number of beds, and it talks about the potential of our healthcare capacity to India.
Yes.
We should converge, we should collaborate and make this stronger. So Christian Medical Ludhiana focuses more on the north and the western side of India.
Yes.
CMC Vellore, being down south, is more focused on in the south and the east and the northeast, with a little bit of penetration into western UP as well.
Yes.
Some of the hospitals have. St. John's is the flagship of the Catholic network.
Okay.
So I think between the three, it plugs in very well to cover the entire country.
Okay, that's a really best thing. I know we have a limited bound of cities of MBBS seats and postgraduate seats, but of late our distance education department is also trying to have other doctors from different colleges to get a touch and the feel of skills from CMC Vellore also. So would you like to highlight how is our future of distance education learning is going to the next level from CMC Vellore?
Okay. You've raised a very important new formula of health education.
Yeah.
India is such a large country with very limited infrastructural capacity. We are already about 2 lakh doctors short of the need. We know that people who go to peripheral setups do not have the advantage of refresher courses and updation.
Yes.
And therefore they fall back in their updating of their knowledge and skill, etc. Distance education, which uses broadband technology or Skype, or nowadays it's so easy through satellite to get this connectivity. So there are 2 aspects of this. One is distance education, where you could beam a lecture or a refresher course or a CME straight to the most remote part of Assam or Bihar or Rajasthan if you just have a Skyping facility.
Yeah.
So you can give a lecture and they can ask questions, it can be interactive. So there's a huge potential which the government must harness. In CMC Vellore we already have a model, but that caters only to the mission hospitals. But I'm talking about an into 10 expansion, and make this as a nationwide open university concept where distance education is used in the best way possible. The second aspect is teleconsultation. Let's say there is a patient with filariasis complicated in Asansol and has no access to private health care. Or any health care. It is possible for him to go to his general physician or his family doctor, who can then even put a camera on him and consult somebody senior in the headquarters, let's say CMC Vellore, where nowadays you can get good images, you can ask details, you can get the data and then tell him what to do. There have been anecdotal cases where even surgeries, an expert sitting somewhere else has advised the surgeon by looking at the field of operation to say, okay, now do it this way or do it that way. So it's got huge potential, and I think it should be harnessed. Again, I would encourage the Christian mission hospitals to get on to this network with CMC as the headquarters.
Okay. Quite often my young viewers and friends usually have this thing is key. We want to become doctors because it's a noble profession and gets good money. A lot of people have this thing and it's a service to mankind. What's your take? What do you tell our viewers whose children are aspiring to become doctors and in the present day world of NEET and everything else, how do they reach out to CMC Vellore for their graduation or even for that matter for post-graduation?
From what?
Is it a viable option? Because in terms of the packages which are offered to a software consultants, is that fast money probably is not there, or what do you say about that?
You need a high level of commitment to get into medicine or anything related to healthcare, because the period of training is quite long. It takes 11 years on a straight uninterrupted track to become a specialist. It is much longer than an IT profession or engineering or management. So my own observation is that throughout the country, the number of people who want to pursue medicine is slowly coming down.
It is?
Yes, it is. And which is now becoming more difficult with more entrance exams and more exit exams and the proposed licentiate exams. So I believe that these are disincentives to young boys and girls who are in school when they compare medicine to IT or engineering. They tend to fall out of medicine, saying it's a long and difficult track to take. But from a need perspective and from a satisfaction perspective, there's nothing that can beat healthcare professions.
I bet so.
So if one were to look at from a need perspective, I would request or encourage more and more boys and girls to take to medicine or nursing or physiotherapy or anything that is related to healthcare, because healthcare is a basic human need. It's not a commodity that you can buy. You can buy nowadays, but it's a basic human need and it's going to affect us. One of us will be unhealthy And we need more doctors and more nurses in this country who are committed to the person, committed to healing, committed to transform a person who is sick at the age of 30. You make him well and he becomes socially productive. No other profession does that.
Yeah.
So to the boys and girls who are in school, I would say read and see and explore the scope of medicine and find out the joy that is awaiting you if you seek that profession as your career.
What about the doctors who are already either students or they are practicing in other hospitals and they would want to be a part of CMC?
Okay.
So is CMC receptive about them, and how they can approach you?
No, absolutely. We have several portals of training and experience. Once you have finished your MBBS from other colleges, quite a handful come to do their senior residency. They finish their compulsory rotation, and we welcome them. We put them into clinical rotations, and from there they might decide to do a post-graduation in CMC.
Okay.
There's another group that comes from training outside, straight apply for postgraduate courses, higher specialty courses, and they get in. They are all quite competent students from, I would say, almost 50% of our postgraduate admissions the last couple of years are students who have trained in other colleges. So we welcome them, and we are quite happy to have a flavor of other people who come into the system.
Okay.
We even employ people who've completed all their education and are seeking jobs in CMC.
Okay.
So they are also welcomed and they also get in.
We are a Bible-based organization, and somebody told me that even for the pastors who are in the periphery, we are kind of training them to become a doctor in absence of a doctor. I think distance education learning is trying to do that kind of thing.
You mean, I think what you are referring to is the pastoral training course for pastors who are outside. They come and spend a year doing this course, which is called Diploma in Pastoral Care. Essentially, it is to train in the techniques of pastoral care to patients. Because doctors can be very busy and they may not have time or interest to talk to the patients.
Yes.
Especially when they are in pain, they are going for surgery, or somebody has died and they need aftercare. Pastors come in very handy. We often use them or request them to come. Most patients would like a prayer before they go for operation or a procedure.
Yes.
Although we can all pray, and we believe that doctors must also pray before, but not everybody will pray because they are busy or they are not available. So we invite pastors. In fact, they can notify the pastoral department to say, tomorrow morning is my surgery, and they will go there and say a short prayer.
So how can we outreach and how can we reach Vellore if there is any queries? Can we reach you directly?
Well, the CMC has a website.
Yes.
It is there on the, you can Google CMC, and there's a very robust website through which you can browse CMC in its departments, healthcare, as a volunteer, as a donor, as a student. So website is the easiest way to contact us in CMC, and we also have people who come and just be observers for a small period of time. So we would welcome and encourage anyone who wants to come and spend a few days.
Yes, that's what I believe. When I was there for 5 years as a graduate, and then I moved to Ludhiana for my post-graduation. And this is what I keep sharing with everybody, that if you're a doctor, you must have to have a taste of CMC and to learn how to do to live up to the alma mater, which is being conveyed through the lifestyle of our seniors, is not to be ministered unto but to minister. And it was worth learning that. I still have few of my memories which reminds me, as in Bible we see God very definitely says, do not compare me, you cannot serve two masters at the same time. And money is something which distracts most of the doctors or anybody in the growing world a lot. And that is what I learned from Vellore, how to dissociate yourself from the materialistic world.
Absolutely.
And to give completely to the saving of the society.
Yeah.
We thank you, sir,
Thank
for
you. Thank you,
joining
Ashish.
us for such a wonderful interview and to get to know so much things about CMC.
Okay.
And we encourage our viewers to reach out to Vellore through the website and to see how you can touch the life of society and can take help of Vellore in doing so. Thank you.